Joining me now is Nicole Lamoureux. She is the director, the national director of the Association of Free Clinics, and who is responsible for today's event. And Patricia Carroll is also a registered nurse who has been treating patients here today.
Hi, my friend.
Your eyes are wet.
Of course they are.
Your eyes were wet in Kansas City when I saw you. It's the same story, isn't it?
It's the same story. We've seen this since Houston. 1,000 people call in advance to come to one of these clinics. It doesn't matter if you're in Houston or Kansas City or now in the Gold Coast. They're still people. They're people. They're not a number. They're not a pill. They're not a statistic. They're people. And while Congress and the President and everyone else is discussing how we're going to make this program work, these people need an answer now. And we do need members of Congress to come and see what's going on. And we invite them over and over and over again. Come and see. See what these people are going through. And if you have to look at it this way, see what your constituents are going through and see what the votes are going through and come to one of these clinics.
Not too many politicians show up here, do they?
No, sir. They don't come. They don't talk to us on the Hill. They don't come to these events. Doesn't matter if it's a Democrat or a Republican. They don't come.
The Washington politicians.
The Washington politicians do not come.
Patricia Carroll, you're a registered nurse. I think you know the lady that I was talking about today.
She was my patient.
What happened?
She was patient number 2 for us today because she called to make her appointment as soon as she heard the announcement on Countdown. That's how badly she needed care. And she had some chronic health issues, but she'd noticed that she had swelling on the right side of her neck, and she was concerned about it. And we were able to hook her up today to get a biopsy and to get her referred. But the problem is, should she need surgery, who's going to pay for it? We don't have surgeons in hospitals here that provide care for free for cancer patients. So now she's got another hurdle that she's got to get over if she needs treatment for a cancer.
Now, a lot of the folks that came through here today and at the other clinics, it's just basic care could curb a big medical issue. Is that a fair statement?
That's a very fair statement.
So many times it's just a pill, it's a basic treatment that could really stop someone from having multiple medical issues down the road in a short period of time.
I actually stopped counting the number of people who brought empty pill bottles from a year ago to say, this is what I was on, but I can't afford it anymore. So we have pharmacists here today who have the lists of drugs that can be filled for $4 a prescription, or what pills can be cut in half. And the nurse practitioner I'm working with today has been able to work with them to change their medications so that they can afford their care.
You're both brave, and you're great at what you do, and I appreciate it so much, and thanks for sharing a part of your life with us.
Ed.
No, it is.
It's what needs to be done.
It's what we signed up for. When I got my license, this is what I signed up for.
But we all should be doing this. There but by the grace of God go I. And every single one of us should be doing this.